Let's talk about sizing for breast augmentation. So one of the most intimidating things for patients having a breast augmentation is picking that implant size, figuring out what size implant that you're going to have, because you're stuck with it for a really long time. So I think the first place to start is to think about what size do you want? How many cup sizes bigger do you want to be? So implants don't come in cup sizes, they come in cc's or milliliters, and about 150 to 200 cc's, depending on how wide your chest is going to take you up 1 cup size. So that often is a good place to start when you're sizing. Now, some surgeons will size you themselves, so they will really tell you what implants will work on your body. They'll take measurements, they'll talk to you about what your aesthetic goal is, and based off of that, they will recommend an implant to you. I personally don't like that. I like to involve the patient more in the decision making, and I find that a sizing is really helpful. So in my practice, I size my patients in 2 different ways. So the first way I size them is we do 3D imaging. We have a photo suite right behind me, and the 3D imaging machine can place pretend implants in you. So it can show you on the screen an estimation of what you would look like with a variety of different implants. So I think that's really helpful to see it on your own body and get an idea of how that would look. I don't stop there though, because I feel like seeing on a flat screen is one thing, but actually wearing the implants and seeing how your clothing fits is a really important piece. So the next thing I do is a sizing with these sizers. So this is from the company Allergan. All the companies have sizing kits. And these are little implants that you can put into your bra, and they're not shaped like a breast implant that we put in you. They're shaped to go around your breasts. So they look more like what you are going to look like after a breast augmentation. And they come in all different sizes. You can put them in your bra, put your clothes on. You can even bring a couple tops that you like to your surgeon's office and try these on and see how they look. And I think this gives you a lot of information that is different than seeing it on a screen. The one thing to note about these sizers is that they are high profile. So that means that the volume will be what you're looking for, but they stick out a little further from your chest. So if you're someone who is not so interested in a high profile implant, these tend to feel a little bustier when you do a sizing than they will be after surgery. And then finally, you can do a sizing at home. So just get rice and a measuring cup from your kitchen that has milliliters or cc's, that's the same thing, and fill it up with dry rice, put it in a baggie, push all the air out, and put it in your bra and try on your favorite outfits. So you can wear that around your house and, just get used to it. See if you like it, see if that size makes sense for you. So I personally think the volume is the most important thing when you're sizing. So as a woman, I know that things can look really, really good, but if it doesn't fit into clothing, it's disproportionate, it feels heavy, that's hard to live with no matter how good it looks. So I always recommend starting with the volume, figuring out how much volume you want, and then we can figure out what implant profile makes sense based off that volume. And then the last thing I'll mention is that when you're doing a sizing, that first sizing you do, trust your instinct, because that's almost always the size that makes you the happiest. The patients that I've had that do multiple sizing, try on implants 300 times, change the size, bigger and smaller back and forth, they almost always end up somehow that original size, whether they get back there eventually or they get a different size and then end up going back and changing the implant. So I always tell people kind of trust your instinct at that first sizing. I think it usually works out the best.